The team that was at booth 22, HRSA's new data analytics platform. Welcome, gentlemen.
Is this loaded up?
No, wait, they have to put it.
While waiting, my name is Srinivas. This is my team, Satish, Romil, and we have some other guys from HRSA. So most of you probably don't know what HRSA is. Show of hands, anybody knows what HRSA does? So that's a minority. So HRSA is basically an agency of HHS. And what do we do? Here is what we do. We basically have programs that provide health care to poor people who are medically isolated or vulnerable and stuff like that. So the idea is to make it equitable. So the second part, what's our mission? Our mission is to make health equitable. What does it mean, equitable? Most people think, all of you here probably have medical insurance. You probably don't need insurance. You've probably never been to a health center. But there are people, millions of people, believe it or not, in USA who need this special care. So we need to give them this so that this problem is addressed and these problems don't come back to us. So how do we manage these things? We basically, HRSA gives out $9 billion in grants and loans to agents that provide this service. So we have a program called EHPs, Electronic Handbooks, that we use to monitor the performance of how well we're doing with this money. So before I get to that, I'm going to tell you a little bit more about HRSA because the mission is what drives what we're doing here. The mission of HRSA, so we have listed only 4 bureaus here. One is the primary health care, where we have 26 million people are being served by primary health care. What about Bureau of Health Workforce? There are about 16 million people that are being served by that. HIV/AIDS, about 500,000 people. MCHP, maternal health and child care, we serve about 61 million people, mothers and children, are serviced by HRSA's programs. So this may be news to many people. So what drives this program? What do we do? So we have to respond to national emergencies. So if these primary healthcare clinics that are providing to these millions of people, they're shut down, they can't get medicine, it's a problem. So during national emergencies, if you had visited our booth, you'd have seen that we had a Hurricane Harvey when we were tracking which centers were open, which centers are closed, because gone are the days the technology needs to be available to everybody. You can't call your phone, 5 people to figure out where you are. You need to have that information now. The idea of this program and platform is to make information accessible immediately so you can make data-driven decisions. That's the key. It's a small change, but with a big impact. That's the point we're trying to make. So how can we surpass Healthy 2020 goals? What are the goals? Everybody's hundreds of goals, but if you're a program, you're looking at specific goals. Like if you are in mental health care for teenagers between 12 and 17, what are you looking for? What's my rate against nation? What's my target? How well I'm reaching my target? So for that, we have a target of 7.5. How can we evaluate against? Do we have data to evaluate against? Yes, we do. Then how can we empower every employee? So gone are the days where the CEOs are making the decision. I have my team, everybody participates in it. I want the bureaus to participate. I want all of you in it because this is a country made of people. Everybody has a say in what we do. And everybody needs to embrace the data-driven culture. Everybody talks about big data, but they don't understand what is the important data. Every different data set is important to you. What's important to a bureau may not be important to a people, right? But everybody needs visibility on the data. So you have to look at the data clearly and make your decision based on data, not based on intuition. Because if you're still making big decisions based on intuition, you're living the wrong time. So I'm going to have Satish present this solution. What did we do as a platform? Remember this is a platform we're talking about. We're talking end-to-end, how the data comes in, how data gets processed, and how quickly we get insights. That's what we're going to talk about.
Good afternoon, everyone. My name is Satish. So I wanted to present this slide. Before I present, I wanted to ask you how many of you know Peter Drucker? He's a famous author on innovation, right? What did he say about the innovation? Innovation should be very simple. Innovation should be focused. And you have to innovate for the present, not for the future, right? Mind these words, and I'm going to explain how our solution is innovative. Our solution drives adoption. Because it is simple, it drives adoption. Many people use it within HRSA. Our innovation creates an impact. Our innovation delivers value. I'm going to demonstrate the impact and value when I show you the results. Now, coming to the solution, we don't want to just create an analytics platform. We wanted to create a framework so that other agencies could use this framework and benefit from it. So we wanted to embrace shared capabilities. So we have automated the data collection, data analysis, and reporting as a package framework. And we have like 50 different modules, and we have like 4 or 5 different big data collection systems, which collects the data from all the health centers across the country. 1,500 health centers submit the data yearly. And there are more than 1,200 measures that we wanted to compute. So as Srinivas mentioned, you cannot make the decisions by intuition. You have to make the decisions data-driven. We want to empower people within our HRSA to make data-driven decisions. So we automated the data collection framework and automatically integrated with the Tableau. Tableau is our tool for analytics. We had integrated the web APIs, and the data collection system directly talked to the Tableau, and all the analytics are happening near real time. That is where how fast we can get the data to the executives and the business users to make an impact. The next slide. So I just talked about the innovative strategy. So I said the innovation should drive adoption. If you see there, 238 users within HRSA, all the mid-level, lower level, and upper level management are embracing the data analytics platform. They have created their own self-service reports for 486 reports, which means every people within HRSA, every manager within HRSA is using the platform. That is driving adoption. By doing so, we have reduced the time to insights by 40% by automating the whole framework. So earlier, let's say if the report used to take like a week to develop by a contractor, now it is just minutes and seconds. If the complex report, it is 1 or 2 days max. And you're reducing the time to insights. On the top of that, we are making $1 million savings per year. And this is the value, and this is the innovation, right? Now, I talked about the impact. The solution should create the impact. We are not much worried as an agency that we are saving the money. We wanted to make sure that we are making an impact on the community, because that is our HRSA's mission. So if you see the impact, so if you see the example as mental health, I take an example because there are plenty of measures, but I just want to concentrate on one example. The screen for depression and follow-up plan. What it means is, if you have a mental health disorder and you go to the clinic, health center, and you are scanned for depression, if you are found positive, let's say 100 people found positive, and the health center says that you need to have a follow-up plan. And only if you see that 60%, this is the latest number, but we have a trend, the 60% of the people are going to the follow-up plan. Ideally, it should have been 100%. This triggers the executives or the business users saying that what is happening, why it's only 60%. That's where we could use the data, we can talk to the health center, educate the patients, and increase the number. So similarly, substance use and disorder. So all these kind of metrics are very useful for the executives to make an impact on the nation. And that's how we serve our mission.
Some of the things that's not apparent here. So there are trends that we look for. So that 716,000 number that you're seeing was 200,000 3 years ago. So you know that the substance abuse disorder is grown up in the poor areas, and it is going to hit your neighborhoods too. Ignoring that problem is not going to make it go away. So understanding it and getting to it wherever it is the way to do things. As far as mental health goes, even that trend is trending actually good direction. It was 30% before, then it was 45, now we're up to 60%. Our goal is still 100%, but if you don't look at this data, because if your poorer neighborhoods are not getting up to snuff, that problem is come to your home someday. Ignoring is not the answer. Understanding and looking at the data is the answer. So we are HRSA, we are one team, and we have a great contractor team, REI system, that helped us build this. We have Accenture Federal that does operation maintenance, so it's not built by one person. This is democracy. Everybody can make a difference. Everybody, and all of you can make a difference by voting for us. That's a separate story, right? But the point I'm trying to make is this data is important for everybody. Everybody should look at it, and whatever can be made publicly available should be publicly available. So you can look in your neighborhood, what's the drug abuse rate in your neighborhood? Why should you not know that? You should know that. So that can only be done if you look at the dashboard, because once it's a dichotomy. We live in a digital world. We're very connected, but we're very disconnected. We do not see what's happening beyond our computer screen. A lot of people are here just sitting on iPads and iPhones and stuff like that. That's great, but you should know your data. You should know where to look the data and what to do and how you can act upon it. This will energize the social workers. If you're a social worker, you're seeing mental health abuse go up in your neighborhood, you're going to go and do something about it. So this dashboard is a simple solution, but it's a huge impact. I want you to think about that.
Thank you.
Congratulations. You emphasize that this is a platform that you want other agencies to be able to adopt and use. If an agency comes to you and says, what are the maybe 1, 2, 3 first steps we should take to do so, what are those steps?
So there are several things you do, so it's end-to-end. How do you acquire your data? You have to understand how you acquire your data. A lot of the health centers, for example, here, they do not have an internet connection. You all have an internet connection, you're highly connected. You're voting on the internet. But there are centers that do not have an internet connection, so you have to give them offline capability to collect data and then upload data. So you have to understand how your data comes in, and you have to understand how you process your data and how you predict. So before you get to analytics, you got to really understand what your problem is. So you got to get the people who understand this problem to look at the data. How are you going to make them look at the data unless you have a dashboard, unless you can show them visuals? Without a visual, like they say, a graphic is worth 1,000 words. So if you can show a couple things, people will understand, hey, this is a problem in my neighborhood. Most people don't even know that these health centers exist. Most people don't know millions of people are getting this. If nothing else, I want you guys to remember HRSA. That's all I care about.
There you go. Congratulations. Thank you.